Hi, this is the gastric bypass pre-surgery visualization for those of you who are having the bypass. This is an important step in getting ready for your surgery because it helps your mind and your body get on the same page. So far, your mind has been the one to make the decisions about the surgery. It's gotten all of the information, it's made the decision, it's talked with the professionals, and your body's just been along for the ride, but the surgery is actually happening to your body. So it's important that it knows what's going on. Some research is showing us that our bodies do much better in healing and need a lot less pain meds when they don't get traumatized by the surgery. And this visualization actually really helps that. So we're going to start with looking at the areas where the surgery is happening. And this chart should look familiar by now. If you look at these two areas where the circles are, you'll see that these are the areas that are going to be affected. So your stomach will be made smaller and into a pouch. And then the intestines, which are routed here through the duodenum and down to the jejunum, will be changed. The digestive juices will still flow from the duodenum into the jejunum, but the jejunum is going to go directly up to your stomach. And so a lot of this will be bypassed, and that will create some weight loss, and that will help with the weight loss process. So notice these two areas that are in the circles because they'll be referred to in the visualization, and that will help give you a knowledge of exactly where we're going with this. So I'd like you to just get comfortable. Either sit in a chair, lay on the floor, lay on a bed, whatever's going to help you, just get comfortable. And we'll begin this visualization. I'd like you to start out by taking some deep, relaxing breaths. Just find your best breathing speed, your most natural, relaxed breaths. As you take your in-breath, breathe in calm, relaxation. And on your out-breath, breathe out any stress or concerns that you have. And find just the right amount to breathe in, the right speed to breathe in and breathe out. And as you do that, begin to notice how much easier it is to let go of any stresses or concerns that you have just for the time being, just while we're doing this relaxation. Continue with these in and out breaths. And as you do, become aware of all of the places that your body is being held by the chair or the bed or the floor. Just let them relax into that place so that it becomes easier to let go, to release. As you continue with this release, begin to gather your thoughts, that place in your mind where they can go and just slow down and be at rest, be at peace. As they gather there, as they slow down, become more aware of how much easier it is to let go of them and of any stresses that your body has been holding. Just continue to let that process happen and find your own best pace to release and relax. As that happens, begin putting all of those thoughts into the basket of a hot air balloon. Just go putting the thoughts in there. It becomes easier and easier. The thoughts almost float in on their own. There's plenty of room in the basket for your thoughts. As the thoughts go into the basket, you become aware that your mind is feeling more free and open and less cluttered. less distracted, more peaceful, more comfortable as you breathe and relax. As your thoughts are gathered into the basket of the hot air balloon, the balloon is ready, and all you have to do is just push it upwards and it releases. It goes into the sky, floats gently away, farther and farther away. And you're able to relax. The farther away it goes, the deeper you move into relaxation. Your mind is quiet and still. You're able to relax and just listen to the sound of my voice as you move deeper and deeper into relaxation. As you do so, we want to become aware of how your body is feeling. Let your mind move into your body. Let it become aware of all of the places that have feelings there. Notice where your shoulders and neck feel, arms and your hands, your heart and chest, lungs, down into your stomach and your pelvis, your legs and knees, calves and feet and toes. Just let them relax little by little, almost as if there was a stream of relaxing coming up through the top of your head, being pulled into the top, moving through your body, all the way through your face, neck, shoulders, arms and hands, down into your torso, flowing out your fingers as they flow into your torso, down your back and spine, your pelvis, your hips, your thighs and knees, calves and feet and toes. Let that stream flow out your toes and your fingers. Just calm everything down. As that happens, let part of you that's the awake part go to the place that it likes to go when you sleep. And let the unconscious part of you become more awake and alert. But still very relaxed. As all of this happens, we want you to put your attention to those circles that you saw a minute ago, your stomach and your jejunum, your duodenum. First, we want to thank your stomach for all of its years of service. It's done an incredible job. It's taken and processed what you've sent down to it. We want to explain that. We're going to make a few changes in order to be more healthy. We want to let the stomach start to move its essence and its life force through to the pouch that's going to remain after this surgery, so that no live part of you will be taken away through this surgery. Let it move its life force into the pouch. And this process will continue until the surgery has taken place. Also, the places in the jejunum and the duodenum that are going to be changing, let their Thank them for their incredible service to the body, of absorbing the nutrients, of moving the digestive juices and the stomach contents through your system. Thank them for everything that they've done. And let them know that soon they'll have a different way to do their job, which will help you be more healthy, which is what they've wanted all along. And have them keep this in mind from now until the surgery so that they won't be surprised when there are some changes. It won't be a trauma. They will be expecting it and welcoming this new chance to help you. Now we want to just imagine how this is going to go for you. And it won't go exactly as we visualize it here, but the nice thing about visualization and about how this works is that it's okay. Your body, your unconscious mind, and your conscious mind will be able to immediately make adjustments as the surgery preparations, the surgery itself, and the recovery take place. So we want to start with the morning that you get up. You will probably have been given some special wash to wash your body with, especially the area where they're going to do the surgery on your abdomen. And some surgeons like you to do it just that morning. Some of them like you to do it several days before. So depending on your surgeon's instructions, go ahead and make sure that area is as clean and bacteria-free as possible. Have your shower and you wake up with that excitement. It's kind of nervous excitement. You're a little nervous because you've never done this before, but you're excited that you get to do this, you get to have this opportunity. And you feel calm underneath all of the excitement. You have your shower, dress, and you head to the hospital or surgical center with gladness, with excitement, with gratitude that you get to have this experience. When you get there, you check in, and they're waiting for you. And there may be some time in the waiting room, and that's fine. You've got things you can do, and if you don't have anything else, just close your eyes and breathe, just like you did a few minutes ago. Breathe relaxation, breathe out any extra excitement or stress that you might feel. And then they'll take you in, and you'll put on your hospital gown and your little footies and get all ready for the surgery. You'll meet with nurses, probably your anesthesiologist, maybe your surgeon, and you'll remember any questions that you've had for them. And when you see them, you'll feel comfortable, you'll feel confident, and you'll feel reassured. They'll put an IV either in your hand or your arm, your elbow, and whichever site they use, that site will accept the IV very, very happily because it's their contribution to the surgery and to the beginning of good health, of better health, of recovery, of being strong. So it's their contribution. It will be pretty easy for that to happen. And you'll discuss ahead of time with your anesthesiologist any concerns or questions you have about the anesthesia. Your lungs and your body will accept the anesthesia well, and it will know exactly how to use that anesthesia in the best way, in your very best way. And after you've been prepared, it will be time for you to go to the operating room. And so you'll either be wheeled down there in a gurney or in some other fashion. When you get to the operating room, it may be a little colder than the temperature in the room you are in, and that's to help you be safe. And you'll notice that perhaps not. We put on the operating table, and you'll notice how calm you feel and how reassured you are that you're in the hands of professionals who've done this before and know what they're doing. You'll notice the activity, the flurry of activity there. People are getting ready for your surgery. The anesthesiologist will be there. Your doctor will probably greet you if he hasn't already. And if you have any other questions go ahead and ask those at that time. Mostly just relax onto the table. Take a few deep breaths and center yourself, balance yourself there. And remember that you're safe. In a few minutes, the anesthesiologist will begin the process of putting your conscious mind to sleep. Usually this is done through medication and through breathing in oxygen. This will seem very easy for you. It will seem very natural. And after just 3 or 4 deep breaths, your conscious mind will be asleep. At this point in time, you're unconscious and your body will be aware of the activity that's continuing after your conscious mind is asleep. The nurses will prepare your abdomen by sterilizing it. And then the surgeon will start his work or her work. And this is done by making a few tiny cuts in your abdomen and inserting an air tube. This air inflates your abdomen so that it's easy for the surgeon to see what's going on there. Also, there'll be a camera so that the surgeon will use to guide the instruments. So the surgeon will then put in a special kind of hand that will go in and cut your stomach area. And most of these cut and staple it at the very same time. So it's all one process. Your surgeon knows how this is done, and it happens very quickly. All of your life essence is now in your pouch, so there's no loss there. There's just excitement because this is the beginning of a new life. Then your surgeon reattaches the jejunum to the stomach directly and attaches the duodenum to the jejunum, just as we saw in the pictures. It happens very quickly, and your body accepts the attachments because it knows it's coming. It accepts it. And every site that has been cut and reattached knows it's coming instinctively. They know it's them. They know that they're getting the call for that. And so when they're stitched or stapled together, they come together just like puzzle pieces and immediately begin to grow together as if you were born that way. It's very easy for the body to do this when it knows that it's supposed to. And we want your body to do this. It has permission, and it has not only permission, but we're cheering for it. We're asking it to grow that way and to heal very quickly. And so that's the surgery. Once the surgery is done, all of the instruments are withdrawn. The tube gets out as much air from your abdomen as it can. It may not get all the air out, but your body knows how to absorb the air. Sometimes there's a little bit of pain somewhere in your body from the air. And if there is, it can last for 2, 3, 4 days afterwards. It's unusual to last for too long. But you can talk to your surgeon or your surgeon's assistant about that. Once that's done and the abdomen is either steri-stripped or stitched together, and again, those pieces of your abdomen will come together just like puzzle pieces, just like they were born that way and there'd never been incisions, and they know exactly how to grow in their best way. So that will come together very, very well. And once that happens, the anesthesiologist will stop the anesthesia, and you'll be wheeled out to the recovery room. And there in that room, you'll begin the process of coming back awake on a conscious mind level. This usually takes a half hour, 45 minutes. And it happens just really gradually. And as it happens, just begin to notice that you become more and more aware of movement, of voices, and someone might notice that you're coming back, and they might even call your name. And then you begin to wake up. And waking up isn't that hard, but it is really easy to fall back to sleep. As you begin waking up, become aware that you want to start taking nice deep breaths. This helps get the anesthesia out of your body. These nice deep breaths do. They also keep you nice and relaxed. You'll also be aware that your body feels different, and it should. You just had some surgery. So it's normal to feel the way you feel. And those feelings will resolve very, very quickly, usually 12 to 24 hours. You'll stay tired and relaxed. And depending on your hospital or surgical center, you'll be reunited with your support people and put into a room for the night. And in that room, they will maybe come and get you for a test. There's a test that doctors often do where you swallow a solution. You're going to sip it very slowly if you do this. And then they put you through a special machine to make sure there are no leaks in the stitches that were done. And you'll go back to your room, and it will feel really good to be awake, and it will feel really good to sleep. It will also be important for you to get up and walk around as much as you can and make sure you've got the support to do that. Don't try to do it by yourself in the beginning. And start getting your body moving. It's perfectly fine to walk, and it's desirable to walk. Just like having a new car, you want to drive it and see what all the gadgets do. Well, this is going to be the way it is with your body for a while. Got a new body, and it's going to be important to understand how it works and to really listen to it. Too often our minds have been running the show, but it's time now to listen to your body. Usually, they're going to want you to start sipping water to make sure that you break in your new stomach, and you'll do it very slowly. If you don't do it slowly, it will hurt. So you'll want to take sips, but do not take sips. Make sure that you do that, even if there's a little bit of pain. Let's talk about your pain levels. Your doctor will give you medicine for pain, and it's important to stay in front of the pain. So on a 1 to 10 scale, don't let your pain level get above a 4. If it gets to a 3.5, let someone know so they can help you manage that pain. Hopefully it will be time for a pain med, but if it's not, then you can manage the pain through breathing and through other types of distraction. But it's important to keep that pain level at a 4 or lower. And with this surgery, the pain doesn't really last that long. Usually it's done in 2 to 3 to 4 days for most people. There will be pain if you go off your eating plan, however, because your stomach is just healing. So I always say to people, look at your abdomen and see how your abdomen is. Is there redness there? Can you see the stitches are still, healing? The same thing is happening inside to your stomach. Plus, we're asking your stomach to work while it's healing. We're asking it to absorb liquids for the first 2 weeks. Then we start sending pureed foods. So your stomach is working through its healing. So be kind to it. Don't hesitate to give it food and water as prescribed by your surgeon. Don't hesitate to do that, but don't overload it because it is in its healing phase. And also remember that if you do have pain, don't let that discourage you because your stomach is healing. So work with it, appreciate it, and thank it. And then the next day, usually you get to go home. And that's a great day. Most of the time you're wheeled out of the hospital, but you could walk if you wanted to because your strength is starting to come back. The anesthesia is pretty much wearing off. And a lot of hospitals and surgical centers give you a little challenge, a lung challenge breathing instrument to kind of help you work your lungs to get that anesthesia out too and to strengthen them. Take advantage of that if you do get that from your surgery place. So go home and do a really good combination of breathing, of resting, and of walking. Stick to the dietary schedule that's been prescribed by your physician. and thank your new stomach and your new intestines for being so faithful and serving you so well. So what I'd like you to do now is do a body scan. Start from the top of your head and just move through to the bottoms of your feet and notice if there are any feelings of concern left, any worries, any anxiety. Notice where they're located if there are, and if they're not, then thank your body. And I'm going to have you remember those locations and what those feelings are for something in just a minute. And I'd also like you to do one more scan to see if there are any questions that your body has for you. And if there are, I'd like you to write those questions down as well in just a minute. Remember those for now. Okay, so let's let the energy levels come up. Wiggle your toes and your fingers and open your eyes if they've been closed and come straight back to the room. And let's do the last part of this. So if you have a journal or a notebook, I'd like you to get that out now and look at this page. We're going to do a little bit of a reflection workout. Write down any insights or knowledge that you gained during this visualization. It could be about anything. And then if there were any fears or feelings that you found when you did a body scan, write those down as well. And then process them with, if you have a counselor, your counselor, or your medical provider, or whoever you can get answers from. If you don't have someone to talk to, you're welcome to call my office for a consultation. And that number is right there on the workout. And then that second part is if your body came up with any questions that you would like to discuss with your surgeon or medical provider or anyone else that could answer that question. Write that down as well so that you'll have time to get those taken care of. All right, that concludes this visualization. I hope you've enjoyed it. And I hope that it's beneficial to you. I wish you best of luck on your bariatric surgery. You've got this.